In the Metro Detroit area, there are so many different people who suffer from either prediabetes or diabetes. Prediabetes is a term, basically, it's just how it sounds, that eventually if you keep going at the rate that you're going, you will have diabetes. Prediabetes is a diagnosis that I like to give to patients because a number of patients, they get an aha moment or a light bulb moment because no one wants to be diabetic, and it's nice to know when you're at that pre-stage. And so when I sit down and talk to patients about being pre-diabetic, we talk about increasing your physical activity, just moving more. And we also talk about decreasing the amount of energy that you're taking in. Most of us are taking in just way too much food. We could probably cut our serving sizes in half. And so I just want to hone in on what prediabetes is. And what we do in order to diagnose prediabetes is we look at something called the hemoglobin A1c, or the HbA1c. And what I tell patients is that you should know your hemoglobin A1c like you know your address or your phone number. It's something very important that you should know. A normal hemoglobin A1c is less than 5.7. So a normal hemoglobin A1c is less than 5.7. Pre-diabetes is 5.7 to 6.4. We diagnose diabetes with a hemoglobin A1c of 6.5. So once you hit 6.5 and go higher, you are diagnosed with diabetes. So a pre-diabetes diagnosis, 5.7 to 6.4 percentage points for hemoglobin A1c, is an important diagnosis for physicians to make. And so what I want the audience to get from this is that you will go in and talk to your doctor, and one of the first things that you should talk to your doctor about is getting a hemoglobin A1c, because you need to know that to make sure you're not pre-diabetic or diabetic. In our part of the nation, probably about 40 to 50% of the individuals in Southeast Michigan are either pre-diabetic or diabetic, which is an alarming number. Diabetes is soaring, probably because of our lifestyle and what we're eating. So the take-home message is to go and get your hemoglobin A1c. And if you're pre-diabetic, do what you need to do not to go into diabetes. If you're diabetic, it's not a death sentence. Find out what's going on with your eating habits and your lack of physical activity, and then you can bring those numbers down. With weight loss, many diabetics can become non-diabetic with weight loss. Now, there are some patients who have a family history of diabetes, and there's a genetic component. But most of this surge in diabetes that we're seeing is because of lifestyle. Behavior modification will allow patients that are diagnosed with diabetes to become non-diabetic. Many patients that I've had, once they've lost a certain amount of weight, they've been able to come off their diabetes medication. African Americans, Middle Eastern Americans, Hispanic, Latino Americans have a higher percentage of diabetes than in your Caucasian counterparts. But diabetes is directly related to weight, at least type 2 diabetes is, and there is, as soon as the weight goes up, the likelihood of diabetes goes up. So when you have a population that has that's heavier, that has a higher BMI or body mass index, the likelihood of diabetes or the prevalence of diabetes goes up.